25 in the hospital, 4 in the ICU, 267 at home. 85 recovered. We have monitored 423 individuals. 263 of those are complete and 160 are active. Those are the people that we know have some sort of known exposure and we have under quarantine and we're monitoring during that time. The confirmed cases, this is just, a graph that shows you the same thing, cases, deaths, recovered. And this is basically an incidence curve, so it's our daily case numbers. So you can see we hit our kind of maximum number of new cases reported in a day on April 1st. We saw kind of this hopeful glimpse of returning down to, less than 10 per day numbers, but we kind of bounced up a little bit. I still say that if you draw, a curve through all of this, we are trending, and that's what you do after the epidemic is over. You draw a smooth curve around all these bars. And our trend right now still seems to be on that downward side if you look at this whole graph and look for that peak. That is the peak in new cases per day, however, not the number of active cases at a time. So we have to get to a peak in active cases at any given time. That's the true apex. So here are cases by zip code. Our 48911 zip code is our highest frequency in terms of number of cases. And then we go down to 48823 and 48824 and then 48910. That looks like this on a cases by zip code map, where you have the different shading for the number of cases in any particular zip code. One of the things that we do in looking at epidemiology and comparing, so what you're doing is you're comparing across zip codes. It's important anytime you compare across localities to adjust for population, and that's done by rate. So I'm going to show you a rate map, but I need to tell you a caveat. We've done it. But when the numbers are less than 20 in any given category, the reliability of those numbers can be a little off. So you do always have to kind of go back to your raw numbers and look at both. But if you adjust those by case or rate for population, what you see is a little bit different picture in terms of, zip code prevalence, where we've got actually, based on the fact that the population is less there, we have a high rate of cases in the Mason zip code, as well as the 48911 zip code. And then you see high numbers also in 910 and 48823 is kind of the next shading of numbers. So that's what a rate map would look like. We'd like our numbers to be higher in order to truly be confident rates, but we don't really want our numbers to be higher in terms of the number of sick people we have in Ingham County. So just so that you can see that, it's always important to take that have that perspective on it. Our demographics by sex, we are 52% male and 48% female. By age group, we've consistently seen this 50 to 59 age group number being our highest percent by age group, with a tapering off back down to our older age groups. But keep in mind, this is the number of infected people. If you took this graph and did this, we only have 6 deaths, so it's hard to do a graph of 6 deaths. But if you did that, you'd see it skewed more, towards the older population. If you looked at statewide numbers and national numbers where you can get more than 6, you would see that cases might be in a younger age group, but deaths are still skewed to the 60 to 69, and then increasingly so at 70, 79, and 80 and over. It is also important to look at prevalence rate by race, also in a rate, because what we know is that our African American population represents a smaller population, or a smaller percent of our population in total. So when we want to look at how this is impacting them versus our Caucasian population, we have to once again calculate a rate, where you see still that we're at not quite 3 times the rate for African Americans over Caucasians, and then we have our other and our Asians in there. So then if you look, as I was pointing out, if you looked at this by percent, you'd see that 61% of Caucasians and 25% of African Americans are our cases, make up our cases right now. But again, we have to adjust that for population and come up with a rate to look at the true burden of disease and impact. we are actually doing quite well in terms of our percent of people that are hospitalized due to COVID-19. I think the highest our numbers ever got in the hospital were 27 or 28. We've been holding pretty steady at 23, 24, 25 for a while, and also holding pretty steady in terms of our number of folks in ICU. I think the highest I've seen that number go was 6. And we've been, just kind of holding in the 4 to 5 range for a while now. So this is just another graph to show you, people who are at home. 90% of our folks are at home. We have the 6 deaths. The percent hospitalized is 7%. We have a 30%. Wait a minute, those numbers don't add up. 29 and 90 does not add up to 100. So we're going to pass by that graph. That must be a different number. So sorry about that. This is what I get when I only get my data 10 minutes before I get on with you guys. Sometimes I don't look at every single chart. So we're going to have to correct that one right now. That can't be 29%, or that number can't be 90%, one or the other. So that is where we are in terms of our data. Let me stop sharing. And the next thing we're going to do is you see, all across the country, in some cases, mayors and other other county elected leaders, city elected leaders doing briefings like this. I think I have been blessed and fortunate in Ingham County that my elected leaders, to a number, as well as my senior leadership at the county, think that this is a public health emergency, and they believe it's important for me to be speaking to all of you. And so they have, stepped back and allow that to happen. And at the same time, lots is going on at the city level, at the county level, and beyond. And we've invited Mayor Shore here today to update you on basically what he's been doing with the city. As I've been briefing you on these things, and he's been kind of sitting back. So you can take over now, Mayor Shore.
Well, thank you, Linda. Yes, Linda and I have been in constant communication. She has been a fantastic partner. The health department's been a fantastic partner to the city, and we have been happy to kind of step back and let the health department and the county take the lead on media briefings, because the real information that you want to hear deals with the health and everything she just said. Many of my fellow mayors around the country are doing daily or bi-weekly press conferences. Many of them run their own health departments, so it makes more sense. But I haven't been doing that. We've been releasing things little by little from the city as necessary. But I do defer to Linda's expertise because she is, as you all know, kind of the expert on the health pieces of this, which are tremendously important. I will say we have released information here or there. Just today, we put out a statement on the protest. I think we just released our yard waste collection information. The city is actually putting together, which may actually be up now on the website. I don't think we've announced it, so you're all going to find out first. A comprehensive FAQ document, very similar to what the state did. We're getting a lot of questions, so we're putting that together in a document that people can review and search. Everything from, one of the common questions we get is, how do I deal with the May election? And the answer is, there is no May election. That's different from other communities. So we want to put together that information for Lansing residents. So that is on our website as of right now. I believe the lansingmi.gov/coronavirus site has that FAQ document, which can answer a lot of questions. So we'll continue to put information out little by little as requested or necessary. I am available to Linda Vail and to the county, but I do want to defer to them for kind of the twice weekly press conferences. But I am here to answer any questions that anybody has of me or of the city. So I'm happy to take questions that you have for me, if not for Linda.
Hi, Mayor. This is Kiara from 6 News. Can you hear me?
I can hear you. I can't see you, but I assume
Yeah, I don't. I'm sorry. This is a learning curve. Here I am.
Okay. You look like Asha. That's why we were confused.
Yeah, and she's off today, but I'm logged into her computer. So
yeah,
got it.
This us working what we have. But in regards to that statement about the protest, can you just speak on that a little bit? You said some information just about like the steps that you would take for a future gridlock. Can you go into that a little bit?
Yeah, we're expecting more protests. We're hearing that there are going to be future protests. I'm not excited to have people come into my community and potentially spread this COVID-19 any further. People have the legal right to protest. We're used to protests in Lansing. We get protests and rallies all the time, but usually they are people who are mass gathered at the Capitol, and Lansing police and Michigan State Police are able to get together and navigate that. Things are a little different now, and now we've got people who are blocking streets. The original thought was that this gridlock protest was going to circle the Capitol and gridlock those streets, and we were ready for that. But the reality was it really caused problems throughout the city, up and down Michigan Avenue, coming from the east and the west, coming from 496. So we need to adjust a little bit. And the statement I put out today, said we're going to adjust. We're going to seek mutual aid from other agencies, because this is now throughout the city. We can't put every police officer we have on a protest because we have the rest of the city that needs to be policed. I can't ignore Southwest and Southeast Lansing with police because we have a protest. We need assistance from other policing agencies. So we will request mutual aid. We are hearing stories. We didn't have specific complaints, but we're hearing stories of ordinance violations and things like that. If someone parks a truck on our street, we're going to cite them for blocking a road. We're going to enforce. Again, people are allowed to come in. They're allowed to. Lansing Police and Michigan State Police work together.
You're breaking up, Mayor Shore.
I wanted to kind of question our first and foremost effort was to make sure that. Did you lose me? Say again?
Yeah, you might need to go somewhere in your house where you have a better internet connection. Seems like your internet connection is weak, so we're going in and out with you. Yeah. Sorry.
How is it now?
It's better now.
All right. Sorry, we've got 4 people in my house that are all on the internet. So we've I forgot where I was. We've learned. I think that we were able to keep people safe, which was the intention, is to ensure safety in the original to this new reality of a protest that stretches throughout the city.
Thank you.
All right, I don't have any questions in the queue. If anyone has a question, go ahead. Oh, it looks like Abigail has a question.
I have a question for Linda. So I'm wondering, I know we spoke a little bit yesterday about the protest, and you as the public health officer of Ingham County technically have the power to, go with a cease and desist letter and prevent protest. Would you consider doing that for a second Operation Gridlock?
Okay, what I can do is prevent large gatherings to the extent that is appropriate to stop large gatherings. So, I spoke to Kyle about this earlier today. So while I can do that, the fact of the matter is that the governor's order already does that. It already says that there aren't large gatherings, that people don't travel, that, all of those sorts of things. So right now we need to let that order prevail. And then we just need to be prepared for what that means in our community. And, the mayor and I have talked, there's some other recommendations I'd like to see, which is that, since people aren't supposed to travel, it's like, okay, well, you're going to go for a drive. You're not going to actually land in my county, which means I need to encourage you to gas up in your own county, in your own community, and to bring coffee from your own community, and to buy your McDonald's, whatever, in your own community, rather than, allowing this, mixture to happen once again in the Ingham County community where, thousands of people are here and, understand there were only, there were a limited number that actually got out of their cars. So, despite the pictures, there were smaller numbers out of their cars than there were people around in cars. But the rest of the interaction that happens as a result of everybody traveling into this community, You know, with a travel ban, it's like, okay, drive your car around, but please don't land here. So that means probably try not to engage in public or, you know, interpersonal interactions with, you know, essential businesses that remain open here as well.
And I had another one, if there are no other questions. I'm wondering, you know, as we begin to see these plans to reopen the statewide economy and reopen businesses across the state, is there going to be an Ingham County plan or a Lansing specific plan? And what would those criteria look like?
You want to go first, Andy?
But for the city of Lansing, we're working on planning to bring city employees back and what that looks like. But a lot of that will probably base on what the governor decides to do. You know, if she extends the order through May 1st, but allows for certain industries to start up again, then we have to be ready to act based on those industries. You know, if construction were allowed again, then we have to have inspectors back inspecting on the job. So we bring back inspectors, we bring back admin to assist, we bring back things for permits. If she allows, you know, so it depends on what businesses are allowed for what we bring back. You know, we're certainly looking at how many people we bring back at a time. We have several different facilities. We have City Hall, we have our foster center, we've got some parking garages with staff. You know, if state employees suddenly get to come back, then we have to make sure all of our parking is ready to go. So I think our response and our ramping back up will be based on what the state allows and as the state allows it. But we're definitely planning for that and looking to see the best ways to do that in a safe way. You know, continuing to have all of the PPE that we need for our employees if we bring people back, having masks and things like that. So we're planning on it. We're planning it. We're looking at some other cities' plans, see what they've done nationally, and we're keeping an eye, and we'll see when businesses open, how that affects what we need from city services.
So from a county perspective, I would anticipate, given all the lessons we've learned in the process of closing, where you saw some county actions that were, you know, ahead of maybe the state. You know, we, you know, cut capacity in some bars and restaurants here to 50% before the larger closures happened, because we saw that as a need. So to the extent that the statewide plan accommodates all the things that we think are important in public health, then it is best for us to follow that statewide plan. So what we know from doing a lot of science and a lot of research on articles in order to get through, you know, past the suppression and into the more let's mitigate and contain again until we get to a point of herd immunity or a vaccine, that there are a lot of recommendations that we're seeing out there. And my hope is that the state is also reading and seeing all those recommendations. The employee screening that we're requiring for essential employees right now, that should happen everywhere. The idea that we socially distance, that should continue to happen. The notion that there are a number of employees that could telecommute should continue to be encouraged, so that we don't have as many people in places at any given time. Large gatherings will continue to be either restricted in terms of the number of people that can be there, or you'll see some, you know, prohibition of large gatherings for a period of time after the basic business reopening happens. And so to the extent that, you know, the statewide orders cover all those things, and I don't have to require screening going into workplaces, I don't have to require capacity to be at, you know, 50%, or now you're seeing the governor in the big box stores with 25% of fire code capacity. To the extent that those things are covered in a reopening strategy, then we will be along with the rest of the state in that reopening strategy. And my hope is that we just have enough voice to make sure that that is covered. Because what it does if we don't do that is it causes a lot of problems for the businesses that operate not just in this city, in this county, but in other cities and counties in this state, and in other cities and counties in other states. You know, imagine Lowe's. You know, Lowe's is everywhere. You know, my son works at Lowe's out in Las Vegas. They have a corporate entity and they have to follow rules, right? Well, when we impose different rules on them in all of their different places, that becomes harder for them to actually enforce those rules and abide by them. So what we want is to be as consistent as we possibly can be, but we also want to make sure that our community is protected to the extent that it can. So, you know, we're ready to, you know, put in additional measures if that's what we need to do. I would hope we have conversations at a statewide level that all of those kinds of good public health things that will get us through the several months after we reopen and gradually reopen are part of their strategy.
And are you comfortable with the amount of testing here in the county for keeping our cases low? And how long do you think the current amount of testing needs to stay here?
So I think we still need to ramp up testing. We've made strides. We've done a lot better at getting more testing and more testing capacity in. You see more and more coming in all the time. These Abbott rapid tests, you almost want to say rabbit in there, are being deployed. They were deployed to Detroit. There's a company out of Grand Rapids that developed a test that's being deployed to federally qualified health centers and tribes across the state. So you're seeing a lot go on with testing, and that testing level is also something that is one of our keys to being able to reopen. We have to be able to test and test in large numbers. If we can't, then we can't identify those who are sick and then isolate those who are sick and quarantine those who are exposed to the sick. And we cannot get through this without the ability to do that. So I see that we're making lots of progress in getting there. I don't have a lot of numbers on exactly what our massive testing capacity is right now in the state, but what I do see is this consistent influx of more and more and more testing capacity. Approvals, the Abbott test has now been approved for confirmatory as a confirmatory test. Originally, you know, because it was a rapid test and there were concerns about false negatives and that sort of thing, they had to go through some processes to make it, you know, one that actually confirmed the illness rather than said it's probable. So a lot of those things are happening, and they're happening very fast, which is not the typical way that the FDA works. They don't usually approve things very fast, but you have, you know, a situation like this is unprecedented, and everybody has got to realize that some things have got to move, and they've got to move fast. So, and that's what's happening.
Thank you.
Mm-hmm.
If anyone has a question, you can jump in now.
This is Rachel from News 10. I have a quick question for Mayor Andy Shore. I know that he spoke a little bit on the protests and the violations and the citations, but it broke up a little bit. Do you mind going over that, the citations and the ordinance, how it's going to work if people are out and protesting?
Well, I guess I'm not sure which part you want me to go over. I don't want to go over the whole thing again. So there are city ordinances that need to be followed. Even protesters, when protesting, need to follow city ordinances. You know, if somebody's in their car and they're driving on the street, that's allowed. If they park on the street and they leave their car and their car is blocking the street, that's not allowed. That's an ordinance violation. We'll ticket that person. If somebody is again, if they violate a city ordinance, we'll ticket them. You know, we've got the executive order and social distancing and things like that. State police usually monitors Capitol grounds, and city police deals with kind of the sidewalks and streets of the city. So the way we've been handling that with everything else with the executive order is people get warned, and if they ignore it, they get cited. You know, we have to have the resources to be able to do that, and we were pretty stretched thin because we have to police the rest of the city this week. But now we will ask for further assistance, and as we have the ability and the officers, then they will address the EO violations as well as any city ordinance violations in the same way. So, you know, I heard a lot of rumors. I heard that people were, that there was a semi stopped in the middle of a street somewhere. I'm not sure if that's true or not, but if we see that, we'll ticket. That's blocking a road. You know, these folks have not paid for a permit to close the street. The streets are still open. What they said was they were going to be driving the city streets and circling the Capitol and creating gridlock downtown. again, they're allowed to drive downtown. There's no minimum speed limits, but if they stop and get out of their car and leave their car in the street, they're blocking the street. So anything that is an ordinance violation, our police officers will be ready to cite them.
I appreciate that. Thank you.
You bet.
Kyle Kaminsky.
Hey, Andy, I just had a quick follow-up. I know we talked earlier about this, and I know that there were no tickets issued for social distancing violations. Are you aware of any ordinance tickets that were issued as a result of the traffic blocking the road or anything like that?
I'm not. I'm also not aware of any, how many official complaints. I know we had emails to my inbox, but we put in the statement this morning. We heard anecdotally that there were people who were urinating on getting out of the street, their car and urinating, and the businesses are mostly closed. There's nowhere to go to the bathroom. These folks did not pay for porta potties or anything like that, which is standard when we deal with rallies and things. We require people to have porta potties and things. These folks did not pay for anything like that, and we heard rumors that people were urinating and things. There was no official complaint, and there were no tickets written. But again, the more resources we have, the more ability we have to patrol the area in addition to the rest of the city. And if a police officer were to see that, they would cite someone for public urination. So, I mean, the drive this week with the limited resources we have were to make sure that everybody stayed safe. There were a lot of people walking around, and we wanted to make sure there weren't any fights or there was no violence. I believe there was one fight, and state police arrested either one or two people. One, yeah, thank you. State police arrested one person due to a fight between protesters. So with the limited resources we had, we wanted to make sure that it was a safe environment for everybody. We'd love to be able to deal with those who generally downtown, if you honk your horn, that's allowed. If you plug into an amp and you're playing your guitar really loud and making a lot of noise, we tell you to stop or we're going to cite you for a noise violation. Again, the more resources that are put out, the more ability that we have to enforce those ordinances and cite if somebody is violating a noise ordinance, violating a street blocking ordinance, violating a public urination ordinance, anything like that. We have to have the resources and the ability to do that without putting officers at risk. So we'll be more ready for that with more resources if others assist us through mutual aid in the future.
Thank you.
You bet.
Does anyone have any other questions for Health Officer Vail or Mayor Shore?
All right.
All right, final call for questions. If you joined us a bit late. Oh, David Ackerley.
I'm sorry, Andy. You thought you were going to get away there. I was just having I was having some technology trouble juggling two different devices. Is there, as mayor, and we broached this a little bit in our phone call the other day, but that was before you put out your plan for the next event. Is there a fine line between wanting to ensure the governor's order is followed, wanting to make sure people are not urinating or defecating, et cetera, and then having so much force out that it almost invites a confrontation with people who are also armed, walking around? Is there a fine line that you're trying to juggle with that right now yourself?
Sure. I mean, you never want to seem, you don't want to go overboard. That's for sure. We know that. We've seen that in the past. But again, for us, we don't have the police resources to police the entire city and put double-digit numbers of police officers downtown. And now with a car-related protest, down Michigan Avenue, down Pennsylvania, down Cedar, Grand, Pine, and Walnut, all of the entrances to the city, Saginaw and Oakland, when you have a regular protest, we can put a few police officers there. A lot of times, as I said before, with the rallies, people will actually compensate the city for usage of police officers. We didn't have that here. So we have to dedicate the resources we can, but I can't put everybody who is available on this protest because we have other issues that need police attention throughout the city. So if we want to enforce local ordinance, and we want to be able to kind of go after these issues that we've been hearing all about by email and on social media and anecdotally, and some by complaints, then we have to have more help. So no, I don't want this to go overboard, but I can't have our entire police force dedicated just to this, because that leaves the rest of the citizens of the city of Lansing without proper public safety. So we want to be able to dedicate what we can. We know MSP has dedicated what they can through their Capitol Post, and if we're going to see this many thousands of cars and 150, 200, however many people strolling outside, and we need assistance, then we will request assistance.
Just one quick follow-up. Will you have any kind of communication with the Michigan Conservative Coalition or any of the other online organizers between now and the 30th?
Probably, yeah. Our police always reach out to folks who were protesting just to kind of talk through what their intentions are. I know they reached out to who is it? The Conservative Coalition. I know they reached out to them in this case as well. Yeah, they always reach out just to say, here's our expectation. Is this what you're doing? Is this what you're doing? They certainly reach out as we create our strategic plan and our operational plan, because we want to have an idea. And again, I think what they heard was that people are going to be circling in their cars, circling the Capitol, and that was our expectation. It's just it grew exponentially throughout the city, and it impacted our neighborhoods, and there were concerns about that. So now we'll adjust to that. If we think there are going to be that many cars, we will adjust to that with our operational planning, and we're working on that. And yeah, they will absolutely reach out to the organizers just like they do for any rally or protest.
Okay, thank you.
Okay. Next, we have a question from Burl Schwartz.
Hey, Andy, how you doing?
Hey, bro.
I'm unmuted now. I'm sorry. I'm sorry for you. What about Sparrow? And I'm sorry I joined late, but what about plans for running a lane around Sparrow or something, so we don't have people go on national TV saying, nurses saying, I couldn't get to work?
Yeah, I'm hoping that that our folks are going to review all of the traffic patterns. I'm hoping that we can more encourage people to come in off of 496 and go north, kind of north on Grand, circle the Capitol, and come back south on Pine. We're looking through all of that. Our folks are going to be having conversations before the next protest to see, is something we can do with MDOT to direct traffic in a different way. So we'll look at the traffic flows and see if there's a way to redirect traffic. Again, we didn't just hear from Sparrow, we heard from the east side. A lot of the pictures that you saw were Saginaw. So we have to let all the people is going to be congested. But if the intention is to kind of come in and circle the Capitol and leave, then we're going to work on traffic flow with the best resources that we can.
So can't you close lanes around Sparrow? I mean, what do we care if these protesters are stuck in traffic somewhere?
No, we could. Yep, it's all options are open. We can block lanes. We can work on different options. Again, we didn't hear from Sparrow that there were issues, but we're hearing otherwise now. Even our ambulance folks, said they were delayed, but they didn't feel that they had any major problems. Of course, that doesn't mean there couldn't have been major problems. There
Right.
certainly could have been, but we didn't see any problems. Sure. The traffic patterns and flow traffic, but seeing a protest like this before, because usually it's just a bunch of people, protesting outside the Capitol. So yes, we will absolutely have conversations about ways to ensure that the traffic can flow, and if we can't move it elsewhere, then we can look at blocking a lane. A lot of it is a request from Sparrow also, so our folks will have to talk to them operationally.
Yeah. Okay. Thank you.
Sure.
I have no additional questions in the queue right now. Does anyone have a question?
All right, I'm happy to join again Linda's doing a fantastic job, and I defer to her for most of the health questions. Pearl, you weren't here, so I'll repeat it. The City of Lansing, we have an FAQ document going up on our website, which will answer a lot of questions. So I invite any member of the media to check those FAQ questions, to talk to Valerie Marchand in my office with questions. But I appreciate our health officer, our health director, for inviting me to be part of this conversation. The City of Lansing stands behind Linda Vail and the county 100%, and we appreciate all the hard work that they're doing.